It has been a very challenging question for the epidemiological research community. The solid environmental risk factor associated with glioma is ionizing radiation. Definitely we know from studies in Europe, elsewhere, using prospective design, exposure to ionizing radiation. Let's say there's a nuclear explosion somewhere, or from subjects who had gotten low-dose radiation for a condition called Tinea Capitis. I don't know if you've heard of it. In Israel, they irradiate these patients who had the skin condition in the head. They're in increased risk for developing glioma. So that's a solid risk factor. And we know that now there's a consensus of opinion, patients who had allergic conditions like atopic diseases, asthma and allergy, there's an inverse association with glioma. However, the underlying biology of what that means is not well worked out. People hypothesize that the immune system is important in protecting the brain from developing glioma, but we don't understand what immune factors are involved. And then there's certain familial syndrome. These syndrome involve rare germline mutations. They give rise to several types of tumors. And sometimes they involve glioma, but sometimes, like for example, neurofibromatosis 1 is a neocutaneous syndrome with mutation in a gene called NF, and basically these patients are in increased risk for developing glioma.